Welcome to Chapter 4, Healthcare Reimbursement Methodologies. Healthcare reimbursement in the U.S. is very complex and can be a little difficult to understand. At times as you move forward through the chapter, it might be a little confusing. So before you move forward, I want you to make sure you know some key terms. Billed charges is one of them. This refers to a price that is assigned to a unit of a medical or a health service that is being provided to a patient. So for example, if I go to my doctor and he or she does an annual history and physical, and the time for that physical is allotted for 15 minutes, the facility is going to bill for that 15 minutes, whether it's 150, 200, 250, what have you. This is the billed charges. Allowable charges is another key term. This is the amount that a third-party payer, which is our insurance company, will pay for a service. So if my physician charges $150 for the annual history and physical, but my insurance company will only pay $100, I am not going to be charged for that $50. Only an allowable charge of $100. Payment, or we can say reimbursement, is the amount paid to a healthcare provider for services provided to a patient. So this would be the insurance company and the patient themselves. So in your book, make sure you go over these key terms and know them. Here are your learning objectives for Chapter 4. In healthcare reimbursement, we have two major types of payments: retrospective and prospective. And it will be key that you will need to know what both of these mean, as not only as you progress in the program, but when you're working in the revenue cycle. Retrospective reimbursement is based on the actual resources expended to deliver the services and is finalized after the services are delivered. Prospective reimbursement is established prior to the healthcare delivery and does not change based on the cost of the actual services provided to the patient. So let's look into detail with both of these major types of payments. So we're going to look at retrospective first. When you are doing retrospective reimbursement, the insurance company bases their reimbursement on the actual resources expended to the delivery of care or services rendered to the patient. Because a patient could be in the hospital for longer than the day, or a patient is receiving maybe physical therapy over a specific prior of time, the total amount is not known until after the services or after the delivery of care is completed. It is important to determine the entire total of care delivered to ensure appropriate reimbursement. So one way to help us capture the correct amount at the end of care is to use what is called a fee schedule. A fee schedule is a predetermined list of fees that the insurance company allows for a specific service. In your textbook, Figure 4.1, you'll see a sample fee schedule for a physician office. So there's going to be some HCPCS codes there. That's going to be new to you. As you're progressing through the program, when you get into classification systems, you'll talk a little bit more about HCPCS codes. Also, a fee for service is considered a contract unit. So what does this mean? Basically, the fee or the amount that is allowed to be billed is set by the insurance company. This is what the insurance company will reimburse providers for the service. If a provider goes over this contracted unit or this fee, the patient is not responsible for this amount, but the provider is. So on your billing forms and your insurance forms, you'll see the allowable charges. And remember, we looked at that key term first. And sometimes it says the submitted charges will exceed our allowable charges for these services. So allowable charges are submitted charges, but then it's less any non-covered charges. Hopefully that makes sense. Your book does a really great job of going into that, so make sure you read that. Also, because your provider has a contractual agreement with your plan, you're not responsible for that difference as the patient between the submitted charges and the allowable charges. Another reason we have a fee schedule for retro payment is we do not know up front what services or how much volume we are going to give a patient until the end of care. Therefore, we're going to use that fee schedule as our guide during the service of care. Now we move to prospective payment. Remember, this is a payment that in which providers receive a predetermined amount for all services they provide during a specific time frame. There are 4 guiding principles for this type of payment. And on page 54 in your book, you will see the 4 guiding principles. So make sure to read that. The thing to remember with prospective is that this type of payment plan, you're going to have encounters or visits with your physicians. Within this, there's going to be established periods of times. You're going to make sure that individual services has been provided for your patients. So to help kind of bring this home a little bit, sometimes HIM professions find prospective payment a little bit more confusing than retrospective. So to help us look at this methodology, let's look at capitation first. This is a part of prospective payment. This is a method of payment for services in which the insurance company reimburses a provided fixed amount for a specific period. This is also called per person or per member per month. Example 4.1 in your book shows how this payment methodology works. So make sure you read this so you know how capitation works. And then if, like I said earlier, this gets a little confusing, please always reach out to me if you're confused with prospective. So case rate is another type of reimbursement methodology for prospective payment. In this methodology, the insurance company reimburses the provider a single payment amount for all care provided during an admission or visit, regardless of the volume of services or total cost of care. So we see this in the inpatient admission within the acute care setting. However, we can see it being used in outpatient, right? Same-day surgeries as well. Example 4.2, which is on page 56 in your book, is a really great example. So 2 patients were hospitalized with pneumonia. One patient was hospitalized for 3 days, the other for 30 days. Each patient is a case. The third-party payer has established a case rate payment of $3,500 for cases with pneumonia. The hospital would receive a payment for $3,500 for each of the 2 cases. So when you read this example, you can kind of see some pros and cons, right? One patient was only there for 3 days. The other patient was there for 30 days. But because we have this case rate, regardless of if we're there 3 days, 4 days, 5 days, 20 days, 30 days, we're going to get paid the same amount. That is case rate. Okay, hopefully I still have your attention. Our third prospective methodology is global payment. In this methodology, the payer reimburses the provider a single amount to cover all applicable services provided for an established time frame. So this is one combined payment to cover services for one service. So an example on your screen here, your slide, is outpatient dialysis. Sometimes patients are seen 2 to 3 times in a dialysis unit over a period of time. That would be a global payment of making sure they are getting 12 dialysis visits a month. or if you have a knee replacement surgery and the global, the package is $9,500. The global amount might be $9,500 or it might be less. However, the patient will not be, the patient would not pay the negative outcome. All right, so hopefully that makes sense. The thing to remember, this is basically a single amount that will cover all services, whether that's 1 service, 2 service, 5 services, or 10 or more. All right. So if you're confused again in this area, just reach out to me and we can talk about it. Our last prospective reimbursement methodology is bundled payment. So in this methodology, a predetermined payment amount is paid to the provider for all services required for a predefined condition and a time frame. So let me give you an example. So with regards to a total knee replacement, so the patient goes to the hospital, they receive the surgery for total knee replacement, they have post-op care, they get anesthesia, they have post-op anesthesia care, so on and so on. Then the orthopedic sends them to post-acute care. Whether that post-acute care is at home, most of the time they are sent to a skilled rehab facility where they will do the post-acute care and receive care there. This predetermined amount is bundled and shared between everybody, starting at the hospital and ending in the post-acute care and then any post-op visits for that knee replacement. This one is pretty easy to understand. Again, it's just a nice big bundled payment that's shared with everybody. Okay, so that is retrospective and prospective. Of course, chapter 4 goes into a lot more detail. So I want you to read chapter 4 and then of course reach out with any questions. For your homework, you're going to do a discussion board over a coding query. So make sure you know what a query is. Make sure you're paying attention to directions as it relates to what needs to be in the discussion board, if you need to respond to students or not. All right. Your other assignment is doing your EHR Go. Make sure, of course, that you've done the orientation. You understand how to get to the EHR Go. You're under the student link. And if you scroll down as you're on the EHR Go platform app, you will see the download. So if you need to download a patient chart, the directions, it's all there for you. And then your other assignment is looking at some ACOs and determining if they are the solution or not. So again, reach out and any questions, certainly here to help you. And I will see you in chapter 5.